Did you know high blood pressure is called the silent killer because it often has no symptoms, yet it affects nearly half of all adults? Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
So, you've probably heard about blood pressure basics, but let's make it personal. What does it really mean for you? Blood pressure is the force your blood pushes against the walls of your arteries as your heart beats. It's like the rhythm of your body's engine, keeping everything flowing smoothly. Think of it as two numbers working together, systolic and diastolic pressure. The top number, systolic, measures the pressure when your heart beats and pumps blood out. It's the stronger push. The bottom number, diastolic, is the pressure when your heart rests between beats, like a gentle hold. According to the World Health Organization, understanding systolic versus diastolic helps you track how your heart is handling its daily workload. Normal ranges? For most adults, a normal reading is less than 120 for systolic and less than 80 for diastolic. That's written as 120/80. If your numbers creep up to 130 to 139 over 80 to 89, that's stage 1 hypertension, or high blood pressure. The Centers for Disease Control and Prevention notes that keeping it in the normal range can make a big difference in your long-term health. But why does this matter to you? High blood pressure doesn't shout for attention, it sneaks up quietly. Over time, it strains your arteries, making them stiff and narrow. This ramps up hypertension risks, like heart disease and stroke, which are two of the top causes of death worldwide. Let me break it down supportively. Imagine your arteries as garden hoses. Normal pressure lets water flow easy. But high pressure kinks them, building up plaque that blocks the flow. For your heart, this can lead to heart disease, think chest pain, heart attacks, or even heart failure where it just can't pump strong anymore. And for your brain? That same force can burst a vessel, causing a stroke that affects your speech, movement, or worse. The U.S. Food and Drug Administration calls high blood pressure a silent killer because it boosts these risks without obvious warning signs, so catching it early is your best defense. You might wonder, how do you know your numbers? That's where a quick check comes in, and pharmacies are a great spot for it, convenient, free, and right in your community. But here's the key. Accurate blood pressure measurement isn't just about the machine. It's about doing it right to get numbers you can trust. Now let's walk you through a simple blood pressure check. Start by sitting comfortably in a quiet spot, with your back supported against a chair, your feet flat on the floor, and no crossing your legs. Rest for a few minutes if you've been active, and avoid caffeine or smoking right before. Now, for your arm. Position it at heart level on a table, palm up. Roll up your sleeve all the way so it's loose, no bunching fabric that could squeeze things unevenly. Take the cuff, it's that soft, inflatable band, and wrap it snugly around your upper arm, about an inch above your elbow bend. You should fit one finger between the cuff and your skin. Too loose, and the reading might come out falsely high, while too tight could make it falsely low. Once it's on, hit the start button on the monitor. Breathe deeply, stay relaxed, and don't talk or move. The machine will inflate and then deflate, and beep when it's done, giving you that systolic over diastolic number. Take two readings a minute apart and average them for the most reliable result. Why go through these steps? Medline Plus from the National Institutes of Health explains that even tiny mistakes, like a cuff that's off by position or pressure, can skew your numbers by 10 points or more, which might lead you to overlook a real concern or worry unnecessarily. Do you see how simple it is? Doing it right empowers you with trustworthy info you can share with your doctor. Next time you're in your pharmacy, ask them to walk you through it live. They're there to help. Sticking to blood pressure basics like this can feel overwhelming at first, but you can keep up with your blood pressure very easily. Small steps, like a pharmacy blood pressure check every few months, eating more fruits and veggies, or a daily walk can add up. If your numbers are high, Chat with your doctor about options. Lifestyle tweaks often work wonders alongside any needed meds. Remember, you're taking charge of your own health, and that's very good. High blood pressure doesn't have to define you when you stay informed. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.